Unit VCS02, Learning Outcome 7, First Aid. This PowerPoint video and associated handout for you to complete will cover the following aims and objectives. Learning Outcome 7 wishes for you to know how to assist with animal first aid, whether that be urgent, ongoing or preventative care, as appropriate. We will cover the following aspects. 7A, explain the fundamental requirements of animal first aid. 7B, explain the limitations of animal first aid. 7C, list possible causes of animal injuries. 7D, describe first aid treatment of basic injuries. 7E, explain methods of hemorrhage control in the first aid situation. 7F, describe ongoing monitoring of the first aid patient in practice. And 7G, state methods to prevent accidents and injuries occurring to pets. What does first aid mean? First aid relates to those initial first reactions to an injury. In relation to the Veterinary Surgeons Act 1966, the purpose of first aid should aim to preserve life, prevent the animal from suffering, prevent the deterioration of the animal's condition, and we should actually assess the animals in relation to ABC. If we're talking about ABC, what do you think that means? Airway, breathing and circulation. Ultimately, the proviso of first aid is that it's the critical first actions taken by a person after an incident has occurred. And hopefully, in carrying out such actions, we can seek to ensure that the following criteria set by the Veterinary Surgeons Act are met. What else does the RCVS require? Within the RCVS Code of Professional Conduct, it states that all veterinary surgeons in practice must take steps to provide 24-hour emergency first aid and pain relief to animals according to their skills and the specific situation. You may have an understanding of this already, and practices do things differently, so it might be that you have an understanding of what your own practice does, but not of what other practices may offer. So in relation to taking these steps, it does not mean that the veterinary surgeon themselves in that practice need to provide this 24-hour emergency first aid themselves. It may be that they have veterinary surgeons that are acting on call who work for the practice during the day and also do night work or weekend work, and would be on call and answerable on a phone and able to get to the practice or to see an animal at home in order to carry out such aspects. It may be that we have practices that work together in relation to supporting each other in relation to this 24-hour emergency first aid. So it might be that local practices have an agreement with another local practice who provides out of hours cover for those practices in that area, and there has to be an agreement in place to ensure that that's the case. It may be that veterinary practices have their own night staff that come in but don't work the remainder of the working week and provide that service within the practice. It may be that practices actually provide, using an out of hours company, that 24-hour emergency first aid at another site. For example, a company such as Vets Now, who again would be able to cater for practices within that area that have signed up to an agreement that they will provide that cover for them. So there's many different ways that practices can do so. The overall aim being that an animal can be seen at any point within a 24-hour time frame to ensure that in the situation where first aid and pain relief is required, that somebody is able to see that animal. Veterinary surgeons cannot refuse to do so, and as we've already stipulated in relation to what the Veterinary Surgeons Act means, we should ensure that those aspects are catered for. So we must try to preserve life, we must prevent suffering, and we must prevent the deterioration of the patient's condition. Now, it may be that you hear of situations where members of the public say that this hasn't been the case, maybe due to a cost implication. Maybe they've been refused to be seen because of that. That should not be the case. An animal should be seen by a veterinary surgeon. And in the situation where money is an issue, it may be that in that situation, euthanasia is the right approach to ensure that the animal's isn't going to suffer, that they're not going to deteriorate, if preserving that life due to lack of funds could actually be detrimental. So we must make sure that such stipulations are in place. We've got those contracts with local practices, etc., or our own out-of-hours service to make sure that our clients are catered for at this point in time. Five rules when being involved in a first aid situation. It is vital that you remain calm at all times. If you're panicking, flapping, distressed, you're not going to help the situation, you're only going to hinder it. And it is important to consider not only the patient's safety at this point in time, but also the safety of yourself and others involved. Consider that animals are generally in shock at this point in time. 9 out of 10 of them are painful, they're unpredictable, they may be fitting, for example, and this could cause serious harm to yourself or others, or the patient if you do not act calmly. So, assess the situation when approaching and check that it is safe for you to approach the patient. For example, is the patient chewing on an electrical cable that has caused for them to be electrocuted? It is not safe for you to approach the patient in that situation. We can use the acronym DRABC. Danger. Look for any signs of danger to yourself, others, or the animal. Response. Response from the animal. Do you get a response? If so, what is response like? Or is there no response to you? Airway, breathing, and circulation. When it comes to airway, we're talking about the airway itself. Can you see if the patient has a clear airway? If not, are you able to clear the airway to ensure that that airway becomes patent? So, for example, if we've got a foreign body, such as a ball, a chew toy, for example, that's actually blocking that airway at that point in time. And is the patient breathing? If so, assess how is it breathing. Is it rapid? Is it slow? Is it shallow? Is there no sign of the patient breathing? Is it in respiratory arrest? Is there any bleeding that you can see? Is the patient hemorrhaging? If so, it is vital that you quickly identify where it's actually coming from. Control it as best you can, apply pressure, and keep actually adding items to apply pressure. So swabs, paper toweling, towels. Don't remove from that site, just continue to add more. If you remove what you're putting on, you're actually just going to keep disturbing any clotting that may be trying to form. And circulation. Check to see how the blood is circulating around the patient's body. Think of ways in which you could do this. Ways in which we could do this would be to have a listen to the heart, have a listen to the heartbeat, take note of this. Feel for pulses in various locations over the body. Consider that extremities will be the first pulses to actually be reduced or go altogether in an emergency situation where the body is trying to fight, to protect the animal. So have we got pulses? Consider digital pulses in the paws, for example. Have we got a femoral pulse? You could also have a look at mucous membrane colour as well, and we can have a look at that in the mouth, in the eyes. What is the animal's colour like? Is it the nice salmon pink that it should be? Or is it dull blue or grey? All of these things can be really useful in helping to build a picture of what is actually going on. I'm sure you've all heard the phrase before, keep calm and carry on, and this is very relevant to first aid situations. You need to keep a cool head as possible and carry on and consider the best interests of the animal at all times. So just a bit of further clarification relating to first aid. Remember, first aid is critical. If we were to define it using a dictionary definition, it would be the emergency treatment that is given to an injured or sick person or animal. And in many situations, that is generally by somebody who doesn't have medical training. It may be the animal's owner. It may be a member of the public. It may be a dog walker, a kennel owner, for example. You may actually be a trained first aider, but that doesn't mean that you would surgically repair a wound to your work colleague's arm. However, in that situation in the workplace, if a colleague had cut their arm, you would, as the first aider, apply pressure to the arm immediately following the incident, and that would assist to stem the hemorrhage. And then you may apply bandages, etc., and send them on the way to hospital. So it is that first initial treatment to assist, and then go from there. First aid. So what can laypersons such as yourself do? You would be able to carry out first aid in its basic form, including ABC. Checking an animal's airway, checking their breathing, their circulation, applying pressure, for example, to an obvious hemorrhaging wound. Aspects such as that. It may be that you think that registered veterinary nurses can do more. However, they can only do the same as a layperson, unless the case is that they have the authority and the delegation and direction of a veterinary surgeon. Consider this scenario. In some small practices, you may only have a few members of staff. Say you have one veterinary surgeon. That veterinary surgeon's popped out for 10 minutes to get a sandwich in the lunchtime break. You yourself and the RVN are on duty and have remained in the practice. You have a client who appears at the front door with their dog who has seemingly collapsed. That dog is going to need first aid treatment. In that situation, both yourself and the RVN could carry out basic first aid only, so your ABCs. What would be pivotal at that point in time to ensure that we meet the requirements of the Veterinary Surgeons Act, to ensure that we're trying to preserve the animal's life, prevent suffering and prevent deterioration, would be that it would be key to get the veterinary surgeon on the telephone. The veterinary surgeon, having been explained to the situation, could then direct and delegate to the veterinary nurse what they could then do. So, can they remove an obstruction from the airway if they can see one? For example, can they place an intravenous catheter so that we've got IV access? Can they administer pain relief? Can they place the animal on a drip? All these are things that would need for the veterinary surgeon to instruct the veterinary nurse to be able to do so whilst they were on the way back to the practice. Obviously, remember, sometimes laypersons and members of the public, or you yourselves as staff, may be involved in something at a client's home or out and about, so at the scene of a road traffic accident or collision, as we may more commonly call them. And again, without any further direction or delegation from a veterinary surgeon, it would only be able to be that basic first aid that could be carried out. What is the difference in relation to emergency veterinary treatment? Kind of is what it says on the tin. It involves treatment that is carried out in the veterinary practice under the direction of the veterinary surgeon, and that can include providing intravenous fluid therapy, placing of a cannula to gain IV access for fluids and drug administration, diagnostic tests including radiography, ultrasound, blood sampling, to name a few, providing medication such as pain relief, and then administering appropriate medical or surgical intervention. The principles of first aid management and treatment. Any first aid performed will greatly assist the patient in the first instance. As we said, we're trying to prevent the patient from deteriorating, we're trying to preserve life. So for example, if an animal is hemorrhaging severely from a pulsating artery, for example, if we don't apply pressure to try and stop that hemorrhaging, then it is likely that the animal is going to lose a severe amount of blood, and that could possibly prove fatal. So any basic ABC treatment carried out will certainly be really helpful. It would also be important in the veterinary practice, and when the veterinary surgeon were to come to examine the patient, that they would assess the patient's neurological status and also take on board any other injuries as well. We need a full picture of the patient's health status, identify any wounds. So for example, with a road traffic accident, there may be multiple issues. We need to identify all, but then actually categorise and prioritise what we need to treat first of all, as some things could be life-threatening, others may not be so. And then once we've carried this out, we can then progress with that emergency veterinary treatment once the animal's been examined. You may or may not be familiar with the term triage, but it's really important for you to understand what it is. Triage is a process where we rapidly classify patients in relation to the severity of their clinical condition. This means that we can treat them in the appropriate order. An example here that I've given would be a GDV, or if we're calling it by the correct term, a gastric dilation volvulus, where we have a stomach that is filled with air, has dilated, probably to a very large size. The stomach would be very, very large in relation to its normal, appropriate anatomical size and situation. And then in relation to the volvulus, that the stomach is actually twisted over severely. Now, that is classed as a severe life-threatening condition. It's going to cause major significant disturbance to the major body systems. It's going to put a lot of pressure on vessels. It is going to disturb blood circulation, and actually those tissues related to the stomach itself could actually start to die, or necrose as we would call it. So if that isn't dealt with urgently, then that patient is going to rapidly deteriorate and potentially it can be fatal. Say we've got in our waiting room a suspected GDV, a Great Dane for example. We've then got a cut pad dog who's been out on a little walk. The owner's applied a pressure bandage on the way and the bleeding has stopped. If we were to place these two into the order of priority, the GDV would take priority over the cut pad. The cut pad is no longer bleeding, it's stopped, so it probably means it's quite a small wound. It might need some surgical intervention. However, at this point in time, that poor little dog from its walk is not going to, be passing away from a cut pad. Whereas if we leave a GDV, that patient is only going to deteriorate. So in relation to our consult room, or if we were taking phone calls from such clients, it is important that our team as a whole, and including you yourself as a member of that team, know how to prioritise such situations. So what is your role as a support staff member? Have a few minutes thinking about your role and what it might consist of, and what we've said in relation to delegation and the role of lay staff. Okay, let's have some thoughts. You will be a really crucial member of staff in relation to communication and information gathering. Your qualified team members are going to need to be able to get on with carrying out appropriate assessment, triage of the patient. And it might be that you are very well placed to gather as much information as you can, either from the owner of the pet, or for example, the person who's brought the animal in. So maybe they've encountered an RTA and they've brought that animal into the surgery. You can gather as much information from them to help to gauge a really full picture of the situation and also the patient's state at that point in time. You can advise owners or members of the public on how appropriately to get to the practice, so information such as postcode, directions, etc. Remember that in this sort of situation, these people are going to be very stressed and worried and upset, so it's important you're really clear and advise them as best you can. You can assist the surrounding team when it comes to triage and examination, so gathering equipment, materials, maybe checking pulses, etc. to assist the wider team. You can carry out general nursing, so setting up accommodation, the prep area to house that animal, getting heat sources such as heat mats, vet beds, etc. to keep the animal warm, or in some situations aspects to cool the animal down. And following the instructions of the qualified veterinary team. So it might be that you, as we say, gather equipment, carry out some monitoring and help to report those depending on your experience and your level of knowledge at the time. Maybe getting items from other areas or gathering other members of the team together. So you can be a really useful member of staff, but it is really important to remember your role and your remit and responsibilities at that point in time. And remember, ultimately, the veterinary surgeon is in charge and is directing even the qualified members of the team at this point in time. So you need to make sure that you are following those instructions at all time. If you don't, then actually your assistance could actually be detrimental, and that's not what we want. Also, keeping that calm head and not panicking in that sort of situation is really important. What advice can be given to owners? Hopefully your veterinary practice has got some sort of information and also a procedure that you can follow in the event of receiving an emergency phone call. It might be that we class it as a triage document or procedure to follow, but hopefully that can be used by all team members, so somebody such as yourself, your veterinary receptionist, your veterinary nurse, etc., so that we can glean as much information about the situation as possible, but also provide them with useful and helpful information at the same time. We need to remember in this sort of situation, animals are not going to be predictable. They are going to be very unpredictable, and anybody assisting an animal at this point in time really does need to take care, as they could themselves, in trying to assist the animal, actually be harmed. The animal is probably more than likely to be painful and more than likely to be in shock. So even when it is their own animal, they need to bear this in mind. And also in relation to the situation itself, they need to, like you would do, risk assess that area to make sure that they're not going to cause any further harm to themselves. They're not going to cut themselves on glass, they're not going to become electrocuted, they're not going to put themselves at risk of traffic, etc. So at home or in relation to the vicinity of such an incident, they could apply pressure to hemorrhage. So placing over, clean toweling, anything that they've got to hand, or even just their hands to a site to prevent bleeding, being excessive, and to try and keep on top of that. We wouldn't want for them to try and remove anything from a wound, such as glass or a stick. In some situations that can be more detrimental. They can, however, quickly, if they've got something to hand, use some clean water to wash over wounds that have been caused by, the animal coming into contact with the road, etc. So little bits of dirt, etc. To try and wash those out to try and reduce infection to a site. But we wouldn't want for them to be removing a stick that's gone into an animal's body or throat, for example. They can also try and cover wounds as well. If they've got cling film to hand, any toweling, any sheets, etc., to make sure that we haven't got any further contamination. And that would be particularly important where we may have organs that are being exposed due to a severe injury. But again, considering that they don't want to be causing any more harm or pain to the animal in doing so. And as we've already said, they must take care to keep themselves and the animals safe. Methods of safe movement and handling. It's really important that you can advise clients on this, but also that you bear these aspects in mind yourself in veterinary practice. As we've already said, remember precautions to keep ourselves and the animal safe, and that is particularly relevant when we're trying to handle or transport injured animals into the practice. Equipment that we can use to help to do so includes collars and leads if the animal is ambulatory, muzzles, a cage or a carrying box. We might need to use a crush cage, and we need to consider the species of the animal and the most appropriate means. Carrying an animal that's been in an RTA on something hard or solid, such as a piece of board, so that we're not going to actually be detrimental to their physical body as such, so we can keep them as still as possible. That would be really helpful. If we can and need to, we can wear protective equipment such as gloves, goggles or protective clothing if we need to. And remember, there are always potential risks to animals and people when we're handling and moving them. They are unpredictable, they are painful, and we've got to try and do as best we can to not cause any further injury or harm to them. So many practices will have items such as stretchers that we can use, that we can get animals onto safely, or tables, so that we're actually doing minimal amounts of movement so we can assess the true extent of their injuries as they are. As talked about in the previous slide, methods of safe movement are really important, and we're wanting to prevent any further injury from occurring. So, as we've already stated, but to clarify, consider that handling must be safe for all involved. It is not appropriate for one small, delicate person to try and carry an injured heavy dog. We need to have more than one staff member, or if we can have assistance from the clients or the members of the public to do so, that is really useful, and then we can instruct them on what we need for them to do. And as we said, use of a stretcher or a board is really important, or a table, in order to prevent any further injury from occurring. And we're thinking of things such as spinal injuries to limbs, etc., that we may not be aware of, but we need to bear in mind. If we can do so, immobilisation of any obviously fractured or broken limbs is vital. We're not going to want that sort of animal to walk into the practice with a broken leg. If we can use rolls of cardboard or newspaper, and again, this is something that could be advised to the members of the public or the client, as the case may be. And any animals that are unconscious must be closely monitored at all times, and again, the use of a stretcher or trolley to move them appropriately. We need to try and maintain their airway, so by extending the neck and putting their tongue forward, like you would do in relation to the human recovery position. Trying to get a patent airway there, ready then for us to intervene as necessary, is really important. So as we've already said, consider that these animals are shocked. They're also likely to be in pain. Consider if you're the staff member approaching them, you might need to use a muzzle. You might need to use something to make a temporary muzzle in order to protect yourself and also the patient. And as we've already said, if we've had the opportunity to speak to the owner on the phone or the member of the public beforehand, they need to be made aware of this. Or if we haven't, if they've just arrived at the surgery, reiterate to them the importance of keeping themselves safe, and the fact that at this point in time, that animal is going to be unpredictable and could cause them harm. Not necessarily known to do so, but they may do. Again, if we have a veterinary surgeon who directs us to analgesia, so pain relief, would be really important to be given as soon as possible, and that can assist us to make the animal more comfortable in relation to handling. We might need to bear in mind specific cases, so actually cats, for example, or dogs that are struggling to breathe, so we class them as dyspneic. We'd want to do minimal handling, so getting them into the practice, into a quiet and safe area, providing them with some oxygen to allow them to stabilise would be really important. And also the types of species that we're dealing with, our exotic or prey species, getting them into a safe, quiet and calm ward that's appropriate for them. Just to make you aware of the different categories that we would use to help us to classify situations that we would encounter in practice. So there's usually two types. We class them as life-threatening or immediate attention. So life-threatening, we'll be looking at first aid situations such as an animal that's encountered severe burns. So maybe they've been involved in a house fire, maybe they've come into contact with disinfectants that have burnt them, for example. Severe hemorrhage, so this may have been caused by something else, such as a road traffic accident or impaling themselves on something, for example, but severe hemorrhage would be classed as life-threatening. Poisoning, we need to try and find out as much information as we can, if possible, beforehand, and getting, if we can possibly do so, the person to bring down what they potentially think the animal has been poisoned with. Road traffic accident, these can be of varying degrees. In some situations they obviously can be fatal, or they might be more minor, or they might be ranging between. Again, we don't actually know the severity of it until we've seen and examined the animal, and very often actually perform diagnostic tests to include x-ray to identify the harm that has been done. Gastric dilation and torsion, as we've talked about in previous slides. Any animal that is unconscious. Prolapsed eyes as well, because we would very quickly need to try and return that eye to its normal situation if we can, or if not, the eye is going to need to be removed because of all the pressure it's going to be putting onto the optic nerve and the pain that's going to be caused by that. Cases that would need immediate attention would be conscious collapse, any fractures or dislocations or broken limbs, an animal that's struggling to breathe, any gaping wounds, hemorrhage but less severe than severe hemorrhage, an animal that is fitting or convulsing, and an animal that is struggling to give birth, so that we class that as dystocia. In comparison to this, you might have things such as cut pads, bleeding nail or claw that's been pulled off. We class those sorts of things as more minor, but it's really important to have an awareness of what would be classed as a really important situation. And one thing that isn't on there that I would like to add further, as this information has been gleaned from the textbook as stated, would be an animal that hasn't been urinating, particularly relevant in male cats. So any animal that hasn't been urinating, that would need to be seen immediately as well. We call these animals blocks, and it does very, very severe and detrimental harm to their body. So anything such as that. But hopefully within your practice, again, you'd have some information about what will be classed as life-threatening, immediate attention, more minor, so that you've got that to consult so you can advise clients correctly at all times. So how can we gather information that we require to inform the veterinary team? We need to ask precise questions over the phone to try and gather history, whether that be from the client or owner or the member of the public. We can use a triage sheet or a practice procedure in order to help us to do so. And the sort of questions that we can ask are the nature of the accident or emergency, any timings that are important, i.e. when did the animal eat the suspected poison? When was the animal hit by a car? When did the fitting first start, and is this something that is normal? So we can relate it to the situation, but try and gauge as much of the background history as we can. We also need to try and gauge whether this is a normal occurrence for the animal as well. So for example, if it is an animal that is fitting, is it an animal that is known to be epileptic, and thus maybe a case of controlling medication better, or is it a case that this is new for this animal? So what is the nature of the emergency is really key. And it's really important for the veterinary nursing team, yourself as a VCA or the receptionist, to be able to take as much history as possible so we've got as much information to go forward with. We can ask further questions on the client or the member of the public's arrival. However, the better prepared we are in an emergency situation, the better for the animal on their arrival to the practice. So here are some example questions. I'm just going to read through those that are stated by the BSAVA emergency textbook. That textbook states that the following questions should be used in such a situation. What is the nature of the injury? How is the animal breathing? What are the colour of the animal's mucous membranes? What is the animal's level of consciousness? Is there a presence of any bleeding, and if so, how severe is the bleeding? What is the animal's heart rate? Are there any wounds, and if so, how severe are they? Is the animal able to ambulate, i.e. walk? Is there the presence of any obvious fractures? Is there any vomiting or diarrhoea, and if so, how severe is it? Is the animal able to urinate? If the animal's abdomen is distended, to what degree is it distended or bloated? And is there any coughing? Other aspects within this slide just to be aware of are information about the animal itself, its age, its sex, is it neutered or is it entire, the breed that could give us any further general indicators of what the situation may be, contact details for the owner or the member of the public, and any relevant medical history, i.e. is the animal on any current medications? Has the animal got any current medical conditions that we need to be aware of? Read through the example questions and make a note of them so you're aware of such things. But what I would really recommend is that you speak to your mentor as to if you have got a sheet such as this or a triage sheet that would help your staff members be able to appropriately ask questions and also support the client or member of the public at this point in time. If you were, and you will do in your time in veterinary practice, are going to be encountering emergency situations. Because if you haven't, it might be something that would be really good to actually produce for the team. Or if you have, then you need to know the location of it so that everybody is working to the same standard and asking the same sorts of questions so that you are getting the most information as you can prior to that animal arriving at the practice. How can information gathering take place? Very often the telephone call is the first point of contact that we will have with this client or member of the public who will be informing us of the situation, seeking our advice and guidance, and very often wanting to know directions to get down to us very quickly. Consider that the client or member of the public is likely to be shocked and distressed, and we may need to take our time, treat them with respect, and let them talk to take on board the information they're giving to us. So we should be empathetic, professional, gather as much information as we can and advise them appropriately as we can. Sometimes a telephone call isn't the first point of contact. Sometimes it is that client or member of the public simply arriving at the practice because they wanted to get the animal down really quickly or they were nearby. What is really important at that point in time is that we need to quickly, and the same with the phone call, we need to quickly establish if the patient has a life-threatening wound or problem. So like we said in relation to our categories, is it something that can wait or is it severe? And if so, then the animal needs to be brought to the practice straight away. Any time delay is going to be detrimental. So we need to quickly get the information that we need, get them on their way so that we can see that animal as soon as possible. So as I already mentioned, if you don't know if you have a triage protocol or not, please find out from your mentor, the purpose of which is that it ultimately ensures that all staff involved, which may include yourself as lay staff, receptionists, etc., would ask the same specific questions and have the same understanding of what would be deemed as an emergency. And all staff that are involved in triaging such calls or receiving such clients or patients into the waiting area should be trained on how to deal with those situations appropriately. Initial assessment must contain ABC and a neurological examination assessment and recording of such details, and this would be carried out by our qualified team members. Again, you may find that your practice has a model or an assessment plan when it comes to systemically assessing a casualty. We can follow the basic mnemonic for ABC, meaning airway, breathing and circulation. We can also follow the mnemonic, a crash plan. And a crash plan stands for airway, circulation, respiratory, abdominal, spine, head, pelvis, limbs, arteries and veins and nerves. However, any assessment must, as we've already stated, as a base include ABC, neurological status and any other injuries to be aware of. Using your textbooks and online resources, I would like for you to research the two terms below, primary survey and secondary survey. And I just would like you to mind map those two terms and just detail at what point they are carried out and also what they would include, just so you have an understanding of the stages that we go through in relation to assessing emergency cases. As we've said earlier in this lesson, the team are vital to work together to prepare for such a patient's arrival. So in most cases it might be the RVN, the SVN or lay staff who may have taken a phone call warning of the pending emergency. So what can VNs and also the remainder of the team do to prepare? We can prepare equipment such as catheters, drips, blankets, bandages, towels, needles, syringes, ensure the oxygen is on, an appropriate kennel is ready, warming aids are ready. We can turn on diagnostic equipment ready to use and prepare the particular area. So it might be that you use a particular room in the veterinary practice to see such patients, such as your preparation room. So making sure that we have all of the equipment and materials that we're going to need is really important. Getting your crash box out and ready would be another really important role for the qualified staff to do. Areas of the practice to get ready would be consulting room, prep room or designated emergency room or ward, and potential preparation of your operating theatre and also your diagnostic rooms. Emergency patients will also need ongoing monitoring. This is a task for you to complete. Please see the adjoining handout. I would like for you to use your textbooks or e-resources to assist you to complete this in relation to what ongoing monitoring is necessary. Think about the frequency of monitoring, so how regularly do we need to be doing so, what type of monitoring will we be performing, and what will we be doing in relation to that monitoring, in relation to recording and relaying of such information to the team. Please complete this task and upload it onto one file for your veterinary educationist to mark to assess your knowledge and understanding of the subject matter. This is another task for you to complete. Please see the adjoining handout. What I would like for you to do is consider, research, discuss with your mentor, and consider methods to prevent accidents and injuries occurring to pets. You can think about this from a home point of view, also a general day-to-day point of view, so while an animal might be out and about being walked, for example, with companion dogs. Think about health and safety measures that owners need to take. Think about the safety around the home and the surrounding areas, such as the garden, and think about access to things that could be harmful to pets. So this is a general overview of how we can prevent accidents or injuries occurring. So what I would like you to do is complete this as a document and upload it onto one file, again for your veterinary educationist to mark. You also have these further tasks to complete. Possible causes of injury. You can link this to methods used to prevent them also, but list certain aspects that could cause injury to animals. Think of those in the home and outside of the home. I would also like you to research how we can control hemorrhage. We have covered that briefly throughout many of these slides, but I'd just like for you to detail using your textbooks the appropriate means of doing so. First aid treatments of basic injuries as well. And what I would like you to do is complete these in full and upload onto one file for your veterinary educationist to mark to assess your knowledge and understanding. In summary, we have covered all aspects of Learning Outcome 7. We've looked at the fundamental requirements of first aid. We've looked at the limitations of animal first aid, and in particular in relation to your role and that of the RVM. You've listed possible causes of animal injuries. You've described first aid treatment of basic injuries, methods of hemorrhage control in the first aid situation, ongoing monitoring of the first aid patient in practice, and methods to prevent accidents and injuries occurring to pets.